It's beginning to look a lot like last Christmas, with coronavirus cases and deaths once again spiking across the country, hospitals overwhelmed, flooded mostly by unvaccinated patients. In this state, deaths and hospitalizations are rising at a much lower rate than we're seeing nationally, but we're still logging more than 5,000 new cases a day, a rate we haven't seen since last winter. A little over a third of those new cases are breakthroughs among the vaccinated, and even some who've been boosted are testing positive, like Senator Elizabeth Warren, who said yesterday she's experiencing mild COVID symptoms. It's frustrating reality for those who've been trying to do the right thing, especially when so many others have not, like Washington State Senator Doug Erickson, who died from COVID on Friday after nearly 2 years of fighting his state's vaccine requirements. It's unclear whether he ever got the vaccine himself. Then there's the CEO of Southwest Airlines, Gary Kelly, who testified before Congress that he didn't think masks did much to make planes safer. Of course, he wasn't wearing a mask as he spoke, and he tested positive the following day. He, too, is fully vaccinated and boosted. But if you happened to be near him during that hearing, wouldn't you feel better if he'd had a mask for your sake, if not his own? And with the Delta and Omicron variants spreading fast, public health officials are expecting things will get worse.
It is going to be a tough few weeks to months as we get deeper into the winter. We are going to be in for some serious difficulties right now, and we better be doing more to mitigate against that.
On that front, Joe Biden is expected to make an announcement about COVID mitigation efforts tomorrow. I wish it had happened days ago, when he's expected to address booster plans, vaccines for kids, and travel safety, among other issues, plus testing availability, with appointments and at-home kits about as hard to find in some areas as booster shots these days. Boston Mayor Michelle Wu also announced today the city will require proof of vaccination for people in the city's indoor spaces as of mid-next month. That'll include bars, restaurants, gyms, and sports and entertainment venues. But with many of these efforts still weeks away and the surge upon us now, what can we do to keep safe and spend Christmas with the family? Joined now by Dr. Bhadelia. She's the director of Boston University's Center for Emerging Infectious Diseases Policy and Research. Dr. Jeremy Faust, an emergency physician at Brigham and Women's Hospital, and instructor at Harvard Medical School. Doctor, it's good to see you both. Thanks for being here.
Thanks, Jim.
Dr. Bhadelia, can I start with you? This announcement by Mayor Wu, I celebrate it. I think it's exactly the right thing. We just read in Lancet, the medical journal last week, vaccine mandates do work. They do cause people to get vaccinated. Are you in support?
Absolutely. And I think, better late than never. I think that we should have done this a while ago, because we do have a population, for the most part, that's willing to take these vaccines. And for the remaining people who haven't taken the vaccines, measures like this will push them to give them one more reason potentially to take that shot. And in the grander scheme of things, with the Omicron variant, that greater amount of protection means fewer people who are unvaccinated that might end up in the hospitals.
Dr. Faust, I was reading your newsletter and you referred to used the term circuit breakers, these short-term restrictions that slow the spread. Does this fall into this category, what Mayor Wu did? Would that be an example of a circuit breaker according to you?
Not exactly. A circuit breaker is really not about whether you're vaccinated or not, although I think that we still believe that vaccination does slow transmission down. Circuit breakers are more like modifications in our usual behavior, things like not going to indoor dining and not going to mass gatherings right at a time when a combination of two things occurs. And those two things are a really large increase in cases at a moment when you already know your hospitals are filling up. So if you can see that combination coming down and looking into the future and saying, wait, given the cases we have today, our hospitals are going to explode on the inside unless we stop this. So we need to change our behaviors just long enough to make sure that doesn't happen. That's what I refer to as a circuit breaker.
Well, let me take a second crack at that. The governor continues to say we don't need a statewide mask mandate, Dr. Faust. Would that fall into your short-term restriction, or am I off yet again?
I think that masks help. They help a little bit and they help a lot, depending on the situation and depending on the mask. And so, yes, I think a mask mandate would help. I think that I was very disappointed to hear that kind of a comment. I was also disappointed to hear the White House say last week that they weren't really looking to make people do anything different who've been vaccinated. I'm sorry, that's got to be on the table. There should be no non-starters. We need everything to be a possibility. Doesn't mean we need to do everything, but everything should be on the table.
I want to get back to Biden in a second, but Dr. Bhadelia, I know you testified at some State House hearing and referred to this mask mandate or non-mask mandate or doing it as low-hanging fruit. And, I was thinking about it today on the radio. It's one thing to be a governor and say we're going to do a lockdown, where clearly there's some losers in that as well as winners. Who's a loser if you do a mask mandate? Why would you not do a mask mandate just with, what's the expression, an abundance of caution? Why not?
Yeah, and it's interesting. I got an email over the weekend from someone who said, look, we all got boosted, and so we did our part. And so I don't understand why you're still asking for mask mandates for really heavily vaccinated states. And to get to the heart of that is exactly what Jeremy said, is that when you have a wave this big, where hospitals are already overwhelmed, more people who are getting more people who are getting infected, even in a highly vaccinated community, means that this fast-moving variant finds people who are vulnerable. That includes the unvaccinated, but that actually also includes people at the extremes of age for whom immunity may be waning. We want to protect them as well. So these mask mandates are allowing, if we're all part of the transmission chain, if we're all getting these breakthrough infections despite our good protection against severe disease, then having these mask mandates can actually help us continue to keep society open. The case that you've heard is that it's going to have an economic impact. I'd say look at the economic impact of potentially not taking all the measures we want to take in this sort of scenario, to the point where we get to the point where hospitals are overwhelmed. That the economic cost of that is then we do have to look at more sterner measures, such as closing down indoor capacity or having lockdowns. We don't want to get there. That's why masks are low-hanging fruit.
Dr. Faust, you mentioned the president a minute ago, and he's doing this speech tomorrow. Again, as I said in the open, I don't understand why he didn't give it the second he announced it. But what does he need to say? I'm hoping, for one, speaking for myself, that he gets rid of this ridiculous, if you have private insurance, you get reimbursed for your rapid tests, and instead provides maybe 1 billion rapid tests through the Defense Production Act or something for the American people. What would you like to hear him say?
I agree with that 100%. And I have what I call the Omicron plan. It sounds like a Robert Ludlum novel or something like that, but it's really got a few things. And one of them is circuit breakers only in places where you need it. We don't want to let's be nimble. We have data, let's be nimble. Number 2 is rapid tests for everyone, not by reimbursement, but raining out of the sky, like manna from heaven. Mask mandates and better masks for high risk situations, because the quality of mask matters a lot, and door-to-door vaccination. Yes, boosting is a part of this, but if you get one person who's unvaccinated to take that first dose, you could have boosted 10 or 20 other people and not gotten the benefit of that one person. So let's go door-to-door to find the people who are actually the wins that we need.
What should he be saying tomorrow, Dr. Bhadelia?
Well, I think there's two messages, right, that I think we're hearing again and again, which is, look, these vaccines are highly protective, which they really are, and the boosters are take it to the next level, particularly for those who are vulnerable, but for all of us, because we're all in this community together. The other is we're hearing is how bad this winter and the next few weeks are going to be for people who are not protected. And I want to point out that one of the reasons it's actually particularly bad is some of the medical tools may not be as effective. Monoclonal antibodies, many of them on the market are not as effective against Omicron, which means that if you're unvaccinated and you're waiting to potentially just get access to monoclonal antibodies, you may not be able to get access to those that are supposed to be effective against Omicron. So Sotrovimab, which is one of the ones that's in shortage right now. But the message that I'm not hearing, which only a president can deliver tomorrow, I really hope comes through, is this idea that, look, this has been a tough couple of years. We've done everything we can. But to get to the other side of this major surge does require not just vaccinated, unvaccinated to get vaccinated, but for all of us to pitch in for a bit longer, because access to healthcare services is a common good. And if people who are vulnerable end up being hospitalized at high rates, then none of us can access care for strokes or to give birth or for elective surgeries. And that's what we're trying to avoid. That's the message that needs to come from a president that I hope comes tomorrow.
How about a message from you, Dr. Bhadelia? Christmas is 5 days away. What's the message to people in great angst about what to do, who to do it with? And if the message is different for the vaccinated and the unvaccinated, please tell me that too.
Yeah, I think that if everybody in your family is vaccinated and the vulnerable at least, but everybody is, many people are boosted, if you can keep the gathering small and if you can layer that by mitigating, changing your behavior, what Dr. Faust was saying, not changing your behavior the week before, not going to indoor dining, not going to major public events where you might be exposed to others. And you're using those tests, in my opinion, you're adding enough sort of layers that you might be protected as long as you're wearing, as again he said, good quality mask, N95s and N95s when you're traveling as well. I think we can pull it off in small gatherings such as those. I think with unvaccinated, you add an extra layer, right? Of it depends on who the unvaccinated is. If it's an unvaccinated, a vulnerable person, that's very high risk right now, and that's really the consideration that needs to go into play. If you're unvaccinated, get your vaccine. However, your immunity will not build before Christmas. And so you need to take those extra measures and actually not get into larger gatherings, because with Omicron, there's going to be a lot of community transmission and you might get infected.
Dr. Faust, you want to add something to that guidance?
No, I think that's perfect. I think what I would add is to think about your own risk parameter, but also the risk parameter of other people. So look, I don't really worry right now that I would get very sick from an infection. I'm not that worried because I'm confident in the protection that I have from vaccination. But I am worried who I might spread it to. And so if I'm going to be hanging out with somebody who has immune compromise or who's too young to be vaccinated, a newborn, then I need to be thinking about those people when I make decisions today about what to do and what kind of gatherings I should attend. And if I do, what kind of mask I'm going to be wearing.
Before you both leave, if we can step back from the local or regional scene for a minute, I want to read a quote from you to you, Dr. Bhadelia. It may have been when you founded the center that you're now running. There are moments in history where our actions require collective metacognition and urgency. It's an anti-isolationist message. And what I take away from it, and tell me if I'm taking away too much, is unless we vaccinate the rest of the world, this is essentially going to be a never-ending nightmare. Is that a fair summary of your message in less artful terms?
You did it very artfully, actually,
so
Jim,
much.
and that's exactly it. It's exactly right that it's not just this crisis, is recognizing our connectivity about this crisis, and this variants have truly proven the point that we are all in this together. But we live in an age of epidemics, and if we don't change business as usual, if we don't work on both innovation but also equity parts of making sure that when we have these crises that we are both protecting ourselves but also the weakest parts of our communities, that we're all going to suffer from that. And that is the collective metacognition that we need to think back and look at how this plays out at an everyday level so that the next threat that comes along doesn't decapitate us even more.
Dr. Faust, I'm guessing you agree with that message, but knowing how Americans see ourselves in the world, is that a reality? Will there be serious advocacy in this country to do as much for people on the other side of the world as we do for ourselves?
Only if people finally internalize the truth, which is that we are all connected and that what happens here or what happens there is actually the same thing. It's just a matter of when. I think that we have been divided by politics, and that's highly unfortunate. But I think that one thing we agree on is that historians will look back on this time and they will ask a very simple question. Given the tools that they had, why did they perform so poorly? It's one thing to look back and say, look, 1918, they didn't have much. What could they do? We have incredible technology at our disposal, and we use it in such a variable way that it will confuse the historians. And let me tell you, historians who are watching this on footage, archival footage, we have the same question. We're wondering the same thing.
Dr. Faust, Dr. Bhadelia, really appreciate your work. Really appreciate your time. Thank you both.
Thanks so much.
Thank you.